I think it's actually abominable right now. I think it was bad before, but I would have said everybody gets seen and has access to, I guess, what you would call specialists, if you need them. But especially in the last few years, the system it's burning, like the embers are burning.
Hey, folks, welcome to this new episode of Healthy and Awake podcast. I'm your host, Mike Vera, board certified health coach. And this is a really cool conversation that I'm excited to share with you today. I sat down and spoke with Dr. Rachel Maurice, who calls herself the unconventional MD. And I have a list here of some of the things we discussed in this episode. She shared her background as a conventionally trained anesthesiologist and how certain experiences in her life really helped to wake her up. Some of that was some personal stuff, and some of that was related to COVID. And she talked about her experience in the Canadian healthcare system, which has always been an interesting topic to myself, as well as some of the listeners I talked to on LinkedIn, some of whom are from Canada. We talked about Dr. Jack Cruz, who's previously been on this show, and we've talked about Jason Christoff, who has also been on this show. And she even helped connect me with Jason Christoff. That's the reason I was able to speak with him on the show, where we talked about coffee maybe 10 episodes back. And Dr. Maurice does have a new program centered on overcoming fatigue, focusing on mitochondrial health and balancing modern life with natural rhythms. So we do get into that in the conversation in the episode, but keep in mind there is a link for that in the show notes below. And before we get into the conversation itself, let me just read you her bio here. Dr. Rachel Maurice is a Canadian medical doctor who has worked as an anesthesiologist for 20 years in Canada. She left the practice of conventional medicine in pursuit of helping people heal from the root causes of disease rather than only treating symptoms. With almost 30 years' experience in the Western medical system, she realized the holes and gaps in mainstream medicine and changed the course of her learning. She has gathered together the skills that have been most beneficial for her and created a toolbox which she draws from based on your needs. You will thus get the benefit of her years of education and experience in conventional medicine, as well as the extensive research and experiential learning of alternative approaches, which most recently include applied quantum biology, holographic memory resolution, self sabotage mindset coaching, breath work, and medical intuition. So, without further ado, here's my conversation with Dr. Rachel Maurice. Dr. Rachel Maurice, thank you for being here with us today. I know listed on your website, you are described as the unconventional doctor or the unconventional MD. Can you tell me a little bit about what you mean by that?
Yeah, well, thank you for having me. It's a pleasure to be here. That kind of came up not long ago. However, my background is I am conventionally trained as an MD, medical doctor, went through medical school. Then I did my residency in anesthesia, and I've been practicing for 20 years, just under 20 years in anesthesia. And well, I left basically in 2021. So after COVID and the mandates and the upheaval in the world, I left. So I haven't been practicing now for just over 2 years. However, I did start to see the corruption and the how much out of alignment I was with conventional medicine prior to COVID. That kind of started in 2017 when my mom was diagnosed with cancer. And she was okay with doing surgery, but she wasn't okay with chemotherapy or radiation therapy. And so she asked me for some help to see if there was any kind of other alternative or adjunctive kind of treatments or therapies. And that honestly, sometimes it's embarrassing to say, but that led me through the door of uncovering all of the nutrition world that we're not taught in conventional medicine. And to this day, medical students are still not taught because I mean, I can say as of 2 years ago, but when I was in the operating room, we had lots of medical students and residents coming through. And, I would supervise them coming through the anesthesia rotation. And I would ask lots of questions. I mean, I was there one on one with them. It's not like I had a group of them at a time, it was just one on one. So there's only so much teaching you can do in an entire day standing with someone. So, you get to know them a little bit. And one of the things that I would always ask though is whether they're taught about nutrition and things that are outside of the convention that I'm learning on my own outside of what I was taught in the system. And the regular response is the nutrition. They ask whether it's the nutrition I'm talking about in the bag that you get intravenously. So a lot of times when people have surgery and you can't actually eat anything afterwards, you'll get your protein, carbohydrates, and lipids pumped in through an intravenous. And my response to them was like, no, I'm talking about the food that you put in your mouth. And they're still not taught anything about nutrition in medical
And
school.
so, sorry to interrupt, you're saying that these are the things that you're thinking about and trying to figure out while your mom is sick.
Correct.
Gotcha.
Yeah. So that opened the door for me to learn more about nutrition than I had been learning sort of on the side on my own anyways. And it kind of uncovered a lot of what was missing for me. And I started to realize that there was a lot of information that is intentionally not taught to us in in the medical school education system. And so I thought it was more greed. I thought it was just more big food, industry and wanting to make money and keeping people sick, but not necessarily with, I guess, nefarious intentions. That speeding up to today that I feel very differently about. And so anyways, going back to sort of learning more about nutrition, that opened the door and I can get into this a bit more if you want me to, but I was struggling myself with some challenges and one of them being going through a really awful divorce, which was tumultuous and went on for years and years. And in 2018, I was in a very, very toxic emotional space. And I came across Joe Dispenza at that time. And that really changed my life, and it changed my understanding of biology, of the human being, of the world, and consciousness and quantum physics, which I never thought I would even entertain diving into, but it really changed me, and it changed my perspective on everything to do with medicine and everything I was doing. So I started to feel out of alignment with what I was doing as an anesthesiologist in the system. I was not shy about talking about that in the operating room with people, because I'm very much someone who talks out loud, thinks out loud, talks out loud, and bounces things off of other people. And the people that are very curious and want to listen are more the nurses in the operating room, I have to say. So when I was kind of bring this stuff up, they were like, no, no, you're doing a great job. Like you're supporting the patients the way they need to be supported. It's nice to have you in the system because not everybody has the greatest bedside manner. As most people know, doctors don't have that reputation of having great bedside manner, but
It sounds like you're saying that the nurses were more receptive to your thinking about all this than presumably the doctors is who
yeah,
you're. Okay,
absolutely. Absolutely.
gotcha.
Yeah.
Okay.
Yeah.
Well, just before we, because there's a lot here, I'm hearing that you went from being, an anesthesiologist working in the system to really going through some pretty uncomfortable things, and I'm sorry to hear about your mom, and what she had to go through. And then on top of that, the what sounds like a nasty divorce,
Mhm.
more discomfort,
Mhm.
and so these uncomfortable things sort of really got you thinking differently about the system that you were in. And I'm even hearing, as we just said, like the doctors weren't very receptive to your line of thinking. And that's, I talk to a lot of doctors. A lot of them do seem pretty stubborn, and I love doctors. So I do want to hear more about that. And one more important detail, this is all within the Canadian healthcare system?
Correct. Yes. Yes.
Okay.
Yeah.
All right. Okay. I'm sorry. Go on.
Oh, okay. So I guess going back to, yeah, just my feeling out of alignment, and I was starting to think of ways to exit the system, but it was very comfortable. It was all I knew, and I got very comfortable, and it became natural and easy for me to practice anesthesia. And to the point where, I could literally not that I was closing my eyes to go to sleep, but, what I'm saying is just to get across to everyone listening, I could close my eyes and I would know like, if I was in the operating room, I would know exactly what's going on in the operating room by the noises, by, like, everything. It was very much a part of me at that point. So, to step out of the comfort zone, really, was not it was not easy. It was easy to just stay the money. I mean, I you have to the medical system makes it easy for doctors to be comfortable. I mean, there's a spectrum, right, of what you can earn, but I was very comfortable, and for me, one of the reasons I chose anesthesia was, I mean, there were several reasons, but one of them had to do with the fact that I knew that I would be able to work part-time and be home with my kids to raise them. Because I didn't for me, there was no point in having kids if I was gonna have to be working 90 hours a week like I would did as a resident and have to hire a nanny to raise them. So, there was no point in that. So, um, yeah, it allowed me to be comfortable, be home with my kids, and, enjoy them. And so, the thought of kind of having to start all over again at midlife, basically, was very daunting, but it was something that was in the back of my mind. It was something I wanted to do, but I really didn't think that I had I guess the drive to do it at the time. And
Yeah.
then the universe gave me that little push in
W
2021.
So before you get into the push and the actual transition itself, I'm very curious about what you did as an anesthesiologist and what it was like working day to day.
So I worked in a few different places, but the last one, so I in Kamloops, BC in Canada. So that's in the interior of BC. And although it's a smallish town, it's about 100,000 people. It's the second largest trauma center in British Columbia. So there's a lot that took place, or there's is a lot that goes on. And so it's a busy place. There's neuro, there's trauma call in the middle of the night, orthopedics, vascular, general surgery. There's lots of, unfortunately, like shootings and traumas and stabbings and that kind of stuff. So what I would do is mostly in the operating room. I would look after patients, put them to sleep, keep them alive while they're asleep, and wake them up. Also working in labor and delivery, putting in epidurals, also putting people to sleep for this one really pains me. Actually, there's a lot of stuff that pains me now that I reflect on things. I would do general anesthesia for ECT, so that's electroconvulsive therapy for psychiatric patients. And now that I've learned a lot more about the psychiatric industry and what I was doing, I feel awful. But anyways, yeah, that, and would see patients preoperatively in the pre-surgical screening to go through histories and try to optimize them prior to them coming in for surgery. So my interactions with patients were very short and limited. They weren't anything that I had sort of long-term or ongoing care for, except for in the hospital when patients were inpatients and stayed in the hospital, and we had to deal with the acute pain either after surgery or someone had a trauma. Um, yeah, we would look after them in that regard.
Gotcha. Well, thank you. And so I guess so you're doing that sort of stuff. All of these events happen in your life, which leads to what sounds like an awakening type of moment, which is I think where we're at now.
Yes. Yes. So when everything happened in our hospital or when COVID hit, I have to say I thought I was scared at the time. I believed fully in the germ theory, which I'm still struggling with. I believe more in terrain now. I understand that a lot more. But I thought this was something bad that, is going to affect everybody. It could potentially affect my family, me working in the system and then coming home and potentially giving whatever I was exposed to my children. So I was taking every precaution at the very beginning with the gowning and the masks and the shields. And I mean, people went, I guess, depending on the hospital, some people went overboard. Like we had ordered, I never used these, but our department had ordered these clear boxes to put over patients' heads to intubate through.
What?
Yeah. Yeah. So that
Wow.
because when you put someone to sleep, most of the time you put a breathing tube down their throat. So that's my job, right? As an anesthesiologist. And when you do that, you have to see what you're doing. So you're getting close to someone's face. So your face is literally right by their mouth and nose. And so it's kind of we we tease each other about it, but some people have had people cough stuff up and it's gone into people's faces or vomit
Oh,
or that kind of stuff. But yeah, it is it's gross. But
yeah.
uh, yeah, there were lots of contraptions that were utilized and at the beginning. But pretty early on, because of the testing that was taking place, it became clear that there was not a lot of whatever COVID was in our hospital. Yet you'd hear all over the news what was going on everywhere else in the world. And I started thinking that our city just got lucky and it just bypassed us. Then I started thinking that I was gonna reach out to friends who I had from medical school and from residency that we all kinda disperse, we train together and then we disperse across Canada and some even across the US and the world, that I would reach out to them and see what was going on with them in their hospitals. And it seemed to be all similar that the news, the mainstream news was blowing things out of proportion, and what they were reporting on was not taking place in anybody else's hospitals. So I started I I've always been very curious and I have a tendency to want to understand why things are happening because that way I can remember like this from my studies, right? Like if I would learn something, I didn't just memorize it. I had to understand it and that way I didn't have to memorize it because if I understood it, it would just stay in my brain. So, I started learning some more things about what was going on and the discrepancies, and I already knew about the corruption, a bit of the corruption that took place in the hospital. In any industry, there's corruption, and most people know about it. I just kinda stayed away from the politics in the hospital as much as I could. But lots of things in previous years that had happened within the hospital, I knew that when the public heard about it, because the media was talking about what took place, it was not at all what actually took place in the hospital. So I already knew that they would put information out that was incorrect. So I started digging and listening to alternative news, I guess news, if you want to call it news sources.
Uh-oh. For sure.
I got hauled into our chief of staff's office several times for asking questions and talking about things in the operating room. And I was explicitly told not to talk about it in the hospital. And if I was asked questions, to leave it until I left work. And one of the issues was that I was wearing my mask under my nose because I know how bad masks are. I actually hadn't worn a mask for almost 15 years in the operating room because of everything that we were taught in our anesthesia residency.
So even while surgery, like, in the middle of some kind of procedure in the operating room, you wouldn't wear a mask?
Yeah, about half of our department.
Hey, folks, just a quick pause on our discussion today because I have something important to share. You know that I'm always in front of screens because I do content creation, my health coaching is done online, I'm doing the podcast, I'm writing, all these different things. And that artificial light can be disruptive to the circadian rhythm, and that can impact your health pretty severely. So that's why I wear bond charge blue light blocking glasses. It's not just a stylish accessory, but it's really a daily defense against eye strain, headaches, disrupted sleep schedules, and really that circadian rhythm that I'm trying to protect. So it does protect your eyes. It does improve your sleep. It does help maintain your circadian health. And honestly, I've experienced fewer headaches and just a better overall sense of my health. I feel healthier when I wear these. And yeah, they do look cool as well. I get compliments all the time, especially when I wear them out at a restaurant or something like that. So, for those who are looking to boost their health in this digital age, I've got some good news. As part of the Healthy and Awake community, you can get 15% off by going to the show notes, clicking the affiliate link, and using the coupon code Healthy and Awake with dashes. So that's healthy dash and dash awake. And you can get 15% off of these very cool bond charge blue light blocking glasses. And that's a great way to enhance your daily health routine and your style. Now let's dive back into the episode.
Too.
Wow.
Because what the research would show is if you are not standing around the sterile field, then there's no increased risk of infection. So we would have drapes up and I'm behind, I'm at the head of the bed behind the drapes. It's funny, we call that kind of the blood brain barrier, the brain on the head side. uh,
Yeah.
so yeah, unless I was specifically doing a procedure on the patient or um, an intubation, putting the breathing tube in, I wasn't wearing a mask.
And that I would imagine is because the masks are really, it's not about the air as much as it is trying to prevent particulate from
Exactly.
going out.
Exactly.
Okay.
Exactly. So it was interesting when I was brought into the chief staff's office because of the fact that I wasn't wearing my mask properly. This person was part-time chief of staff and part-time an emerge doc. And, I know that he knew that masks actually didn't do anything. And when I would bring it up, he wasn't like I could tell he was very uncomfortable and didn't want to respond to me. He just kept saying, you need to wear your mask properly.
Hmm.
And that was kind of it. But um anyways, so I guess where was I at this point? Yeah, so I was starting to see a lot of discrepancies of what was actually happening, what real information was coming out and how information was being suppressed and how the media was putting out incorrect or I don't know what the word misinformation, disinformation, if we call it nowadays, disinformation. So, I was feeling a little stressed working. For example, myself, when I would talk to people about anesthesia before coming into the operating room, there were certain risks that I would talk to them about specifically. And then other ones I just didn't because they were so small. Like a lot of people, well, I shouldn't say a lot of people. Some people have a fear of going under anesthesia and not waking up.
Sure.
So that really that it rarely happens. You have to be going in on your
It
way
it
to
does happen though?
it. Well, it can, yes.
Wow.
It can. And, there are certain things that can happen with people that have certain genetic traits, but it's very rare. It's very rare. The other reason or the other way it would happen is basically if someone was already dying and then they went into the operating room for something to save their life and we just didn't get there and do things fast enough.
Yeah.
But it's pretty rare to not get to someone through an anesthetic alive.
And not to go on a tangent here, I'm just curious about which of the, because my understanding is that when someone's under anesthesia, there's usually a combination of different things. I had surgery once, they told me it was ketamine, fentanyl, and all sorts of other fun things, and I was like, "Wow, okay." So is it maybe genetic incongruency with some of those types of pharmaceuticals?
You mean if people have issues with anesthetics?
Yeah, I mean, I had never even considered before my surgery that there was a chance of me not waking up. I would have definitely processed that a little differently, so I was surprised to hear that.
Well, no, with the things that you mentioned, like in the operating room, most of the time it's controlled. So, when we put a breathing tube down, we're managing your breathing. We can manage your breathing, we can manage your circulation. So, if there are certain drugs that cause problems with those, that's not really the issue. It's more so there's a couple of uh, kind of genetic traits where there's a specific reaction to either like a volatile anesthetic, which are the gases that keep you asleep, and they can cause something, for example, that's called malignant hyperthermia. So, I mean, malignant's kind of the bad word, and then hyperthermia meaning increases your temperature, but really what it does is I mean, we don't have to go into detail about this, but it's something that can cause death if it's not caught, but we're trained to pay attention and notice the signs of when that potentially could be happening. And that is something that's familial, so it runs in families if one person has it. So we always ask if there was any problems with any anesthetics in any family members. But again, we have 5 years of training, and it's for the times where there is kind of the shit that hits the fan, right? The
Yeah.
rest of the time, I mean, in the US, they have nurse anesthetists. We don't have that in Canada, at least not yet. They're trying to push it, but that I think nurse anesthetists is 2 they have 2 years of training, but in Canada, we've got and for physicians, it's 5 years, and it's really for all of the catastrophic things that can potentially happen so that we're prepared to deal with those.
So there in America, there's a lot of debate between our healthcare system and the Canadian healthcare system. I've even seen TikTok videos of people complaining, "Oh, I have liver pain, and it's going to take me 6 months to get seen in the Canadian healthcare system." And I've spoken with other Canadians who have basically confirmed that that's the case.
Mhm.
And I looked at the comments, and there was a back and forth, a disagreement with some people, and someone ultimately said, "Well, at least in Canada, we can get seen." Here in America, if you don't have the money, maybe thousands of dollars to get seen and get tests and all these things, that, our system might be worse in that way. So I'm not asking you to necessarily debate about the differences between the two.
Yeah.
Um, but I guess what are your thoughts about how effective that the Canadian healthcare system actually is to getting people seen and helped and all that?
Well, I think it's actually abominable right now. I think it was bad before, but I would have said, yes, everybody gets seen and has access to, I guess, what you would call specialists, if you need them. But especially in the last few years, like the system is like it's burning, like it's the embers are burning. And what I mean by that is I know when I left, my daughter kept asking me like, "Well, they're gonna ask you back, right? Like they've got to ask you back." And I'm like, it was bad before, we were short staffed, like, and that's a huge problem. I was like, well, they're gonna have to because otherwise nobody's gonna get seen, right? And they weren't asking us back. They weren't asking us. Still in BC, they still haven't asked anybody back. In British Columbia, it's the only province in Canada that they haven't asked anyone back to work, the healthcare staff. But it used to be that, for example, if you were diagnosed with cancer and you needed surgery, they were on the top priority list of getting in within whatever number of weeks because you have to be on top of that if you think of it from that perspective, which I don't anymore, but going back to thinking of it from that model, you have to get people in to catch it before it spreads. Now, they're just not getting in. Like, it's not being caught for, like, 6 months, and the staff, like, in our hospital, they had to divert labor and delivery. We've got, like, a high acuity NICU here. Like, for preemies and stuff, we had to divert labor and delivery. We had to close down for 3 months last year, any elective surgeries because of short staffing, and I'm hearing from other people in other parts as well, like, 2 years for an MRI. So people aren't they're not getting or they're getting access, but it's taking a long time, which by that point, whatever problem you've had, it's gonna make things you're gonna be a whole lot worse, or it will have gone better, you don't need it, but I don't that's not really the case now. But yeah, it's interesting. It has to do with most of it has to do with staffing,
Hmm,
I would say.
okay.
Yeah. And so it's terrible. I would not personally so I've been working in that system for 30 years. I would not I would not go in there unless it was like an accident and I had to.
Yeah.
I would not access the system voluntarily.
Yeah, I know someone who she described it as fleeing Canada so she could get help with, she was pregnant, and actually my dad is the one that tended to her. My dad's a neonatologist, and, yeah, she said it was just such a better experience than what she had previously gotten with one of her kids in the Canadian healthcare system. So I thank you for, describing some of that. And the FDA, well, here in the States, the FDA allows exactly that. It's a third of the drugs are eventually pulled from the market, and usually with the data they have, they know probably from the very beginning that it will eventually be pulled, that it will cause some harms, and all the chemicals, all the forever chemicals and the microplastics and all these different things that they don't seem focused on at all. I like to think of it as death by a thousand cuts because
Yeah.
that's really what you see. It's not necessarily that microplastics from cereal packaging is that alone is going to kill me.
Right.
But when you think of all these little things that add up that we know are harmful, all these little things that add up, what is the cumulative effect of all that? And
Right.
you mentioned expressing these ideas and that people would dismiss them. I I don't know if you follow me on LinkedIn or not, but I occasionally I'll post, "Hey, maybe it's not a good idea to spray our food with things that we know are carcinogenic, things like glyphosate. We know it's carcinogenic." And I'd say 90% of the people, it's like, obviously, yeah, that makes a lot of sense. We shouldn't eat food that's gonna give us cancer. But there's always like 10% or so, they're always not even MDs, they're usually some kinda chemical science or like a chemist.
Mm.
And they're always the ones who are the first to, "Oh, you don't know anything about the chemical process of glyphosate and how good it is for our food systems." If we need to put cancer on our food in order to have a flourishing food system, there's something seriously wrong with the food system. So I definitely see what you're saying with germ theory and terrain theory, and I haven't read up on that at all. But I do wonder, just because I know a lot of skeptics listen to this show, and just to play devil's advocate here, is I'm wondering about the practicality of cleaning the terrain, right? We are being poisoned. We have all these different things. It's in the food, the air, and the water. Hey, folks, if you're enjoying this discussion, but you feel like something might be missing or we're just skimming the surface, you're absolutely right. Due to certain restrictions here on YouTube, we've had to adapt the way we present our content here. But don't worry, you can find the full uncensored conversation over at Rumble. So go down to the show notes below the description in this video. Head over to Rumble for the complete, full, uncensored Healthy and Awake podcast experience where we dive deep into the topics that matter most without holding back. Find the link in the description below, and I'll see you there for the full story. Do you think it's practical to actually like do something to our environment, or would that just be our home or our bodies and that's the environment? And I guess like how would that work in practicality?
Yeah, it's a very good question, and something that for me, I think that I've had to come to terms with probably every day is there's only so much I can do. Like I can do what I can do, and that's just gonna have to be the best that I can do. Having said that, I am a recovering type A personality, and that's partly kind of led me into anesthesia, I think. So I have a tendency to go all in when it comes to things. But in the last, I'd say, year and a half, my understanding of how the human body works has changed fundamentally. And that was after starting to learn from Dr. Jack Cruz, who I know you've had on your
Yeah.
show. And he really, I mean, he's a brilliant man. Half of his stuff goes over my head. And it's so in depth and it's just a whole other language because there's so much physics to it. But the implementation of what he has to offer is not difficult. The challenge is more understanding, but that's what I've been trying to learn for the last year and a half. And the reason I'm bringing this up is I think there's always been like toxins and poisons in the environment, but our body has been able to adapt and deal with them because we have been in sync with the environment. And so our body has been working properly. But because of so many changes, and one of them being our light environment, which is now more artificial than natural, we've completely disrupted how we function. And so if we kind of right that, if we bring harmony back to, and I mean harmony, like the proper signaling for what our body, our cells, our mitochondria will do with the right signals, then it just knows what to do. Like, I'm a firm believer that our body knows exactly what to do. It knows exactly how to detox from things. It knows exactly how to adapt to changes in the environment. It's constantly healing because we're constantly breaking down cells, right? I think the number is every 7 years we have basically an entirely new body. All of the cells of the different organs and different tissues in our body turn over at different rates, but they all turn over, right? Like every 3 to 5 days, we've got a whole new lining of our GI tract. So if we, our in saying that, our body knows exactly what to do and we can clean it out if it's working properly. But we're doing so much in our environment to make it not work properly. So that's part of the issue, and so there's only so much you can do with broken parts, working with broken parts in your cells, right? And, what I was gonna say, there's just going back to what I mentioned about mitochondria, so that's something that I have really been diving into a lot is mitochondrial health, because really the mitochondria are at the basis of our functioning, and I've been trying to explain some of this to my kids. They're older now, one's in first year university, and the other one's in grade 11, but so they've already gone through learning about the cell, right? I think it's grade 8 or grade 9 science where you learn about the cell and you come home and you have to make a little ball with the whatever organelles are inside, and there's like one little mitochondria, right?
Mhm.
And that's not the way it is, right? Every cell has hundreds to hundreds of thousands per cell, and they make the energy for our body to actually function. If we don't have any energy, our body can't do anything, right? We're just a corpse without energy. So the mitochondria are really what determine our health, and our mitochondria respond to so many things, and a big one being light signals, right? Light and dark. But
Yeah. I do see a lot more health professionals paying attention to mitochondria. And of course, you mentioned Dr. Jack Cruz seems to be one of the people at the top pioneering that. But just to make sure I understand correctly, basically, you're putting forth that the body can, or at least should be able to take care of itself and prevent us from getting sick. But in order for that to be true, we should avoid all the poisons in our environment as best as we can, which might be tough, but we should still try to do it, while also realizing that it's tough to be healthy if we are out of balance with our circadian rhythm. And the world that we're in now, let's face it, most people are out of balance with their circadian rhythm because they're not getting sunlight. Maybe they're working in a building all day. And on top of that, they're coming home at night. Maybe it's midnight and they're blasting their face with blue light from the phone, which then tricks the brain into thinking it's actually daytime.
right.
And it's almost like the functions within their body are totally inverted. It's doing daytime stuff at night and it's doing nighttime stuff during the day, kind of.
Yeah, exactly.
Okay.
Exactly. And one thing that I found very sort of enlightening. And again, this stuff, none of this is taught in medical school.
Right.
And granted, that was 25 years ago for me, but still, again, I ask a lot of the students that had come through, and this is not being taught. But the light signals actually are what determine our hormonal and neurotransmitter synthesis. And that was something that was a big revelation for me, I would say, especially being now perimenopausal, because so many people, you go to a doctor and they're just, I mean, the first thing they want to do is put you on exogenous hormones, right? Hormone replacement therapy. But after learning this, knowing literally that there's a crescendo and decrescendo of light that happens from sunrise to sunset with what appears, how much it, of the frequencies that appear. You have the layering of like red and blue at sunrise, and then there's UVA rise. And that basically signals through our eyes and our skin, but in particular through our eyes, a whole cascade of starting with we got cortisol, we've got melanin production, we've got thyroid hormone production, serotonin, your melatonin, your norepinephrine, your dopamine, like just so many of those key hormones and neurotransmitters that if you don't get the light, then your hormones are going to be completely off balance. Right? And so such a simple practice is of making sure you actually see natural light at key times of day can actually allow your body to do exactly what it knows to do, right? And
Which to most people just sounds crazy to like, "Wow, the light is gonna, help me with my" it does really kinda sound out there, but it is true.
yeah. And so I'll share with you and the listeners an experience for me. Now I've had going through medicine, I think most people know that doctors are on call for things and different specialties have different determinants of how often the call is and how onerous the call is and how much you're up at night. But anesthesia, when you're on call, you're in the hospital actually going through the emergency list of surgeries. So we're working, we're not sitting at home waiting to get called like if, a baby's going to be born or trauma's coming in or something. So a good amount of the time I have been sleep deprived. My sleep's been completely disrupted and like I hated it. I would actually try to give away as many calls as possible, even though that was where you made a huge amount of money. Like to me, it wasn't worth it. Just intuitively knowing it just felt gross. But my sleep has been so messed up and I'm constantly exhausted. And this ties into kind of what I'm actually doing now to help people. But again, when I discovered Jack Cruz, he was the first person that I'd heard talk about any of this circadian, the first person I heard talk about the circadian stuff and quantum biology and the physics of the human body as opposed to just the biochemistry. And so I'm all for experimenting on myself with things, especially when I don't think that there's going to necessarily be harm to it. And I had been exhausted, constantly exhausted for years with the divorce, with kids. Like when you've got kids too, you're up at night and you've got a dog and you can't recover from call because you can't sleep after call because of the kids that you have to look after. And so I was exhausted to the point where when I'd be driving for longer periods of time, and I mean longer, I mean even 30 minutes, but there are cities close by that my kids would be in activities that we'd have to go to for the day. So driving between 2 and 4 hours a day, I literally had so much trouble keeping my eyes open driving. Even if I don't drink coffee, but I would have chocolate. I just don't like coffee, but I would eat chocolate. I would eat anything that I thought would help me stay awake with caffeine, and it just didn't help. And it was pretty disturbing. I didn't wanna drive. I didn't wanna drive at night because it makes you even more tired.
Yeah.
Um, but I started implementing all of the things that Jack Cruz what I was learning from Jack Cruz, and I kid you not, um, within 3 weeks within 3 weeks, so it actually seems like a long time compared to, what takes place with other people when they start to implement this stuff, but I had an abundance of energy through the whole day. Like I was never tired. I was never tired. And I exercise, like I'm up early and I I exert myself. So I'm draining myself, like I'm using energy. And I was just not tired at all until bedtime. Right. I mean, which is when you should be tired. But
Yeah.
I couldn't believe it. Like literally I'd be going out at sunrise to walk, even if it was just a 15-minute walk. And if I was tired before, like when I got up, I'd go outside and within 5 minutes, I literally would feel like I've had a cup of coffee, which again sounds crazy. And I told a friend of mine this in the community that I'm in, one of the communities, and she told me that she thought I was completely exaggerating. She didn't believe me at all, and she was just kind of placating me when I was talking to her, but then she decided to try. And she could not believe it. She said going out now, like, she gets up, her clothes are on her bed, she just gets up, throws them on, and goes out the door. So she's up, like, 5 minutes really before the sunrise, and then she's out the door, and she said it's been like, it's changed her whole perspective, her whole day.
It sounds like some of what you and your friend did to really change the amount of energy that you had, at least one of the things that you mentioned was just waking up early and trying to get some sunlight. So what other changes did you make based on what Dr. Jack Kruse says?
So I started blocking artificial light, in particular at night and also on screens. Like both you and I are wearing the blue blocking glasses, but I started learning a lot about the blue light emitted from technology and just how it can mess up our entire functioning, right? Like talking about the light signaling hormone synthesis. Well, the light coming from our technology signals that it's noon in June and it's gonna produce all the hormones, and regardless of what time you're looking at that screen, so early morning, late at night. And so our body blocking the artificial light at night allows the melatonin that is naturally released at night to actually work and do the repair and the regeneration in our body and in our cells and our mitochondria at night. So that was a big thing, which I know some people still are very kind of skeptical of it. They say that it doesn't work. And the research that is out there that shows that the blue blockers don't work are only on the glasses that are clear, which actually don't block the blue light that is problematic. So the other things actually really were because this was in the early, kind of late winter, early spring of last year. I started really doing stuff, but I did a lot of grounding. So I was walking every day in bare feet. Everyone in my neighborhood kind of knew that I was the weird one walking around in bare feet.
Yeah.
And I changed my not necessarily my diet in terms of what I ate, but I changed my eating pattern. And so I started eating breakfast within, at least a short time period within 30 to 60 minutes of the sunrise or waking up to reinforce the signal that the day has started. And before that, I was actually doing the fasting. I was on that intermittent fasting train because there's always some kind of fad that seems to take hold. And, I kind of was thinking about that from the perspective of helping to increase autophagy to clean out my body and my cells, right? But now realizing that actually kind of it worsens things from the point of view of your body thinking that you're stressed and
Mm.
therefore going to have all the consequences and repercussions from that stress take hold in your body. So I also made sure that I was not eating between 3 and 4 hours before bed because any amount of food then just sets off your whole digestive system, and then the energy is going into that, and it's not going into the repair and regeneration that should take place at night. So that was something else that I changed, and I started a little bit implementing cold therapy, not quite like everyone like you hear about going into frozen rivers, although I did do that once, but
Nice.
that was just too much for me. But I actually do cold baths 3 times a week, and the only reason that I've been able to be consistent with it is because I learned that if the bath or any kind of cold water therapy is below body temperature, it still has an effect. So it doesn't have to be, whatever 0 degrees or whatever Fahrenheit, 32 degrees. It doesn't have to be that cold in order to have the benefit. As long as it's below body temperature, you're still getting benefit. And so, there's the science behind it, which I've learned or I'm learning because obviously I don't know it all. But since discovering Jack Cruz, I kind of have found a whole other community and went through the Applied Quantum Biology Institute to get certification in that. And I'm still doing ongoing learning. through them. So,
That's great.
yeah.
Well, I will say that the ice cold baths are a lot of fun, maybe something to sprinkle in here and there. One of the things that I find most interesting about what you said when we first met is how you're not only following Dr. Jack Cruz's work, but another guest that I've had on my show, Jason Christoff.
Yes.
And the work that you're doing now seems to be a perfect intersection of, at least in some sense, the work that each of them does. So let's shift a little bit into Jason Christoff and some of his work, or even just some of the philosophies that you might have learned from him that stand out to you today.
Yeah. Yeah. So Jason Christoph's been very impactful in my life. And I think if I could just go back to saying before COVID, like around 2017, 18, when I kind of came across Joe Dispenza, I started to learn about the subconscious mind. I mean, I knew about Bruce Lipton and quite a few other people, Lynn McTaggart. Like there's a lot of information on the subconscious mind and how we are programmed from when we're children and how we play that out in the rest of our lives and so on. So I understood that from one perspective or one vantage point. But when I came across Jason Christoff, which was in about spring of 2021, and I started listening to him, I really liked his method of delivery because he's very direct. There's no mincing words and there's no misunderstanding of what he says. And he has lots of documentation to back up what he says. It's not just his opinion. So I started to understand the subconscious programming from a completely different perspective. And it all started to make sense to me. And that's how I've been able to shift and really understand that the world is very different and it's orchestrated very differently from how I had thought. But one of the things that I didn't understand very well, which I do now, is the subconscious mind really has one job, and the only job of the subconscious mind is to keep us safe. And in order to keep us safe, it counts the repetitive content in our environment. And whatever is most repetitive goes to the top of the list. And you will gravitate towards that. You will act that out. You'll think whatever those thoughts are. You'll say whatever is being said because you won't have any control over that because you just don't have any control over the subconscious programming. So, looking around in the environment of what's happening in the world, it's sort of understandable how the population has been herded into thinking certain things and behaving certain ways from that vantage point. And so that was really, really very eye opening for me. Um, I didn't quite, I couldn't quite wrap my head around the orchestration of the manipulation through the propaganda, through the media, through the entertainment industry, right? Like it's all we understand in advertising when people are trying to sell food or you've got like a fast food chain or you're trying to sell some kind of like running shoe or something like that. People understand manipulation of human beings to try to sell a product. But I think that it's hard for people to actually put that together and think that there's anything more behind that. And that's really what I learned from Jason Christoff. And not only that, he was really instrumental for me in having the shift in mindset that I could actually start some kind of business on my own, that I have the capability of doing that, despite the fact that I spent the last 50 years doing something else. Or not 50, I guess 30 years. But, it allowed me to step out and, venture out and start a business of my own. Helping people. Now feeling like I'm actually helping people with their health as opposed to just managing their disease or trying to keep them from getting sicker, which is what I felt like that's what I was doing in the old system. So yeah, I guess the other thing that I think is very well, not only did Jason bring that up in terms of me learning from him, but he also veered me towards the path of other learning, and so I took some courses with Paul Lindertz, so I'm not sure if you've come across him.
Mm-mm.
So he's someone that Jason knows very well and has had him on his podcast several times, but he wrote a book called I think it's The Root Cause of Cancer, What's in a Tear, and it
Okay,
has
yeah.
emotional suppression. So he's worked for over 10 years, I think it's 10 or 15 years with people who, excuse me, been turned away from the mainstream system saying, "We've done all we can do, just go home and get your affairs in order." And those are the people that have gone to him, and he's had like an over 90% success rate with reversing cancer and people healing because there's a lot more of a connection with our thoughts and our mind and our emotions to the physical expression that takes place in our body that's just ignored in conventional and traditional medical model. But I also took a course someone else, Jason, pointed me towards, and this was a trauma release method. And I then went and took a course with the original creator of this method. So this guy's name is Brent Boehm, and it's called holographic memory resolution. And it has to do with our memories being holographic in nature and actually stored physically in our bodies. And those traumas, most people think I would have said I didn't have any traumas growing up or even trauma in life until I understood that trauma really just meant an overwhelm to the nervous system, which is up for interpretation because everybody interprets that differently. And especially when you're a child, there are lots of things that are traumatic that you wouldn't think of as an adult are traumatizing. So those things are trapped, they're stored in the body until they're released. We're not taught how to release them. So most people actually carry those around with them and they can drain you of your energy. They can block the communication in your body. And so you can end up manifesting disease from that as well. But also, those, what was tied in nicely with my learning in that was something else that I came across from Jason's information was all about mind control through Kathy O'Brien's work.
Yeah,
Um, uh,
MK Ultra.
yeah. And so what she describes a lot in her interviews and her videos is very similar to how trauma is stored in the body. And you basically, it's like the subconscious programming. You will respond based on those traumas that are trapped in you to anything else that is, any event that takes place in your environment. And you don't even realize that you're responding a certain way based on a pattern from before because it just might not seem congruent in terms of like what an event that took place and your response just doesn't seem like it should actually be that type of response, but you're actually responding, your body's responding to what took place however many years ago. You just don't realize that's where the response is coming from. So, yeah, so the method that I'm using actually helps people release those stored trauma from the body in a very gentle and supportive way.
That's great. Yeah, another book that comes to mind, I on this topic, I think, is The Body Keeps
Yes.
Score.
Yes, that's a wonderful book.
Yeah, which talks about some of that.
Yeah.
Well, it sounds like you're doing some great work. So now I know you mentioned to me that you were working on some kind of program and so can you tell us a little bit more about the work that you are doing now and what that program looks like?
Yeah, so I'm in the midst of building an online program, which will be 12 weeks in length and it on demand. So basically you get all of the modules up front, but then I'm also doing weekly Q&As and support. So any questions people have in terms of implementation of certain strategies, I can answer or the science behind anything, but it has to do with overcoming fatigue. And so that's something that's obviously very personal for me that I've experienced for decades. And it's just been so life changing for me that I felt like I had to share that with people. And so the program, it's for people with fatigue, but just about everybody has fatigue. So it doesn't necessarily matter where your fatigue is coming from. Like lots of people who have chronic illness have fatigue on top of having the chronic illness, right? Some people just have fatigue from overworking, or some people lack of sleep. But ultimately, yeah, I mean, I go into this in the program, but again, I was talking to earlier about mitochondria,
Yeah.
and really our mitochondria is where the energy is produced. So it has to do with tending to the mitochondria.
Wow. Well, is that ready or is that almost ready?
Almost ready. It's not quite ready yet. Yeah. But I am starting a wait list. And for people who are interested, my beta launch will be at a significantly reduced price. So if anybody's interested in uh, the initial program where I'm working out maybe technical glitches or getting any feedback, that would be great. So, yeah.
Yeah, well, I'll be sure to post a link to that in the show notes below. And I guess my last question for you today, is there anything that we have not yet talked about that maybe we should?
I don't think there's anything else except for, just what's going on in the world. The place where I'm at right now, and I would encourage people to get at, because obviously people who are coming and watching your podcasts are people that are informed and want to be informed and are are ready to find information that challenges any kind of narrative. But I know for myself, I was caught at the very beginning of all of this. I was caught up in going down almost every rabbit hole just to see what was there, which took up a lot of my time and energy. And I found that I wasn't necessarily progressing in life in a direction that I wanted to. And now I'm on a trajectory where I think I'm trying to balance staying informed, but also creating what I want to see for my future and the future of the world. And I think putting energy towards that, we can't necessarily stop what's actually happening by protesting per se. I'm not saying that isn't necessary in some forms, but I think putting our energy into more creative avenues is better use, and I think it'll serve us better, but and it just won't give energy towards the negative stuff that's actually happening. Because if we the more time we spend sharing that kind of information, the more energy we are giving it to grow, right? Like, I think there's that parable about the wolf and feeding it, negative feeding it something like negative versus positive. Whatever you feed it is gonna grow, right?
Yeah. Oh,
I would just encourage people to, if they can, it's hard sometimes to let go of some things, especially the way a lot of people were treated and even still treated today with what's taken place. But I think there's enough people out there that are like-minded that when we surround ourselves with those people, we can really move forward a lot faster.
definitely. It sounds a lot like, focus on what you can control and stop worrying about all the things, not stop completely, but, don't overwhelm yourself focusing on things that are just beyond your control.
Yeah,
Kind of?
yeah.
Okay. Dr. Rachel Maurice, I thank you so much for your time and for sharing what you did. I know our audience is going to love this. I'll make sure to put your links down below. And yeah, thanks again.
Thank you. Thank you for having me.
Hey, thanks for listening to this episode of Healthy and Awake podcast. Please remember to leave us a 5-star rating on Spotify or Apple. Or if you're watching this on Rumble or YouTube, please be sure to give us a thumbs up and leave a comment down below. Let us know what you thought or if you had any questions based on what we talked about in this episode. And of course, it couldn't hurt to share it with your friends, those who maybe are awake, or those, of course, who are waking up.